John, would you mind, if you don't mind, give us your age?
I'm 79,
Okay.
almost 80.
79 years old, and you came to us with right shoulder pain, correct?
Yes, sir.
So you came to Pinnacle and you had very severe right shoulder pain. We noted that he had some rotator cuff problems, and we have done a regenerative procedure for his right shoulder. We did our Pinnacle Gold program, which is PRP and bone marrow aspirate injections. And John is really happy with our outcome. He's done really well. So what was life like before your treatment, John?
Well, I more or less, if I couldn't do it with my left arm, I didn't do it. Now I can pick things up, but as far as doing other than just carrying it, there was no strength there.
Yeah, and I remember your range of motion was a problem as well. Right. And what were you unable to do that made you upset?
Well, since I retired, I do the odd jobs, and I've been working for a relative, and I just couldn't do it.
Yeah, just couldn't get anything over your head.
Tools, I had no strength to hold, pick them up or use them or anything.
Okay. So, and what finally triggered you to come in and meet our medical staff here at Pinnacle?
Dr. Bartell. I've been a patient of his for years for my back, and I told him about it, and he said that he would get in touch with you. So he thought it would be a rotator cuff, surgery type thing. And then when I got here, where you said, well, the muscles they're just gone. So it was out of the question. So we went to the other alternative, and it seems to be working fine.
It's working great. It's working amazing. What concerns did you have before the procedure?
That I would not be able to do anything.
Yeah.
And I'm not ready to quit.
No, sir. No, we're not ready to quit on you either.
I've had friends that, when they retired, they didn't do anything, and it didn't take very long.
And for you,
they're in the ground.
Right. And your alternative was to have a shoulder replacement. And we just couldn't do that. You're so active. We can't have a lifting restriction. And so for you, stem cell and PRP made a lot of sense. And what was the procedure like when we did it here in the office?
It was fine. Like I say, Michelle told me exactly what I was going to feel. The injection, the deadening process was no problem. When she went into my pelvic bone, she told me what I was going to feel when she hit it the first time.
Yeah, exactly.
And it was kind of a shock, but it was exactly what she said. And after that, everything went fine.
We really do our very best to explain exactly what a patient's going to go through when they come to us for a procedure. And we take a lot of pride in patients like yourself understanding what's going on.
Yes, sir.
So that's really important for us. What kind of downtime did you have after the procedure? When did you return to your normal activities?
As soon as it warmed up a little.
So a couple of weeks? How long was it?
I would say a couple of weeks after I came, we started the procedures here, and then I was going to therapy, physical therapy. And after a few weeks, I finally started feeling like I could do more.
Yes.
And I learned that I would probably have restrictions on what I had done all my life. And maybe I should slow down, but
well, we don't necessarily want you to slow down too much.
I'm not ready to.
Got it. And so, what's life like now? What can you do now that you hadn't been able to do before you came and saw us?
Any of my construction work, more or less.
So using tools above your head, you can lift things.
So I could lift. Now, lifting things I never had any problem with, but going above my head,
Mm-hmm.
and there was every time I would do it, I mean, I could feel and hear it cracking.
Yeah, and not
inside.
doing that anymore.
And
That's great.
it's very seldom.
That's wonderful.
Does something.
So what would you say to somebody who's considering coming to do one of our regenerative procedures or one of our wellness programs here at Pinnacle Integrative Orthopedics and Sports Medicine?
I would say, without a doubt, that I would jump on it in a minute.
Well, thank you. Do you have anything else that you want to mention to patients? I know you'd mentioned anything that you'd like to say about our staff. We take a lot of pride in taking great care of people.
Oh, everyone here has been ultra friendly and very professional, and I'm going to miss you people.
Well, we're always here to take care of you. Hopefully we won't need to see you anytime soon.
Well, that's true.
Give me so it's your right shoulder that we did, right? Yeah. Let's reach on up. All right, my friend. Okay. There you go. So John has done really wonderfully. Come and see us. We'd love to take care of you.